Hello everyone, my name is Samson Yohannes. I'm from Marley University as well as from VODAN Africa. Today I will be presenting about the data pipeline in VODAN Africa as well as a verification platform that we use to create fair data. I'll start by introducing you VODAN Africa and proceed forward. In VODAN Africa, what we try to do is we try to create fair data at point of service to improve the quality of healthcare. And we try to, in most of the health facilities that we have been working with, most of them were reporting, generating reports to be sent to the upper level management. But in VODAN Africa, we try to reverse that and then make the data producers to be the users of the data that's produced by them. And also we've created a data strategy program which helps them curate, process, analyze, and visualize data. The objective being to create a data that's findable, accessible, interoperable, and reusable, which is a patient data that's going to be both accessible for humans and as well as machine readable and machine actionable data. And all of this needs to happen without it leaving the health facility where it's produced, or without losing its provenance and being produced and used at the health facilities themselves, or in a federated manner, to make it findable, accessible, and reusable and interoperable. We try to follow the FAIR principles that we try to integrate into the systems that we build. And we also have this guiding framework called FAIR OLR, which stands for ownership, localization, and for adherence to regulatory frameworks. All the systems that are produced and all the data that's produced needs to be owned by the health facilities, and all the systems need to be deployed in residence, or need to be localized to the context, culture, and resources that they have, and also need to be compliant with the local regulatory frameworks as well as global regulatory frameworks such as GDPR. And that we are working with different types of data, or that's clinical data and research data. At this current phase of the project, we are working with COVID-19 antenatal care service data and outpatient health data, which we try to make it fair. And also we're working with research data on COVID-19 and migration and other data sets that come by. And to be able to do this, we've developed an architecture which allows us to enter the data into our systems. We are using CEDAR Workbench at each of the facilities to create metadata templates and to collect data, and then that data would be entered only once, and then it's visualized in the internal dashboard by the health workers and external dashboard by anyone interested to learn about what's happening. And we have different kinds of stores, such as triple store for query, which we will be discussing later. And also most of the health facilities that we were engaged in use a system called DHIS2 for monthly, quarterly, and other reports, which most of them were computing manually, and our system is interoperable with that system, so that the report is generated and is sent to that system. Now we'll look at the data flow and what each facility has at the moment. Each facility, we have here 1 up to 88 facilities that are listed here, and each facility has a CEDAR workbench which will be used for data, for metadata template creation as well as data collection. Well, also in some cases they had data that is available in Excel or in other formats, and we try to verify that data in the form of bulk input, and also we have the internal dashboard and DHIS2, as I said earlier, for reporting, and Allegro graph as a triple store for making a query. And the system is also interacts with the external dashboard to be able to visit the data that's available in each of the facilities, and also the aggregate data can also be is also exposed to through an API and through Allegro graph for query. And each facility, when they build their templates, they use control vocabularies which are hosted in Buyer portal. Not only are they working with existing templates that we gave them, but they also have the capacity to create new templates, so that when a new outbreak or when a new need arises to collect new form of data, this platform allows them to collect data. Also, the platform is arranged in such a way that a federated query can also be performed. Algorithms can be deployed, because each of the systems have a Docker install, and a Dockerized algorithm can be sent to each of these facilities, and a federated query or federated analytics can be done. In the case, in some places, like the case of in Tigray, the resource requirements were very tight, and because of this, the ongoing war, we had to develop a lightweight system, because we couldn't load all of this into the existing infrastructure. So we used that CEDAR only for as a template engine. Then we have built a new system to collect or to create fair data. The same system sends a report to DHIS2 to triple store, and also we have a lightweight mobile application for that, and also works with bulk input as well. This is a screenshot of the application that I was mentioning earlier for the lightweight system that we are working with. This is the external dashboard that we have, which the health facility sync data to, and it also has an API which allows others to be able to sync to the system that we built. And this is a result of a query from research data, as well as the clinical data that we have tried to create or to show. So in general, what are the real values, or what VODAN Africa as an ecosystem or as a platform looks like? I'll try to go through each of the points that I have here. We've built a fair infrastructure, or an infrastructure that allows us to create fair data, which will allow, or which is an infrastructure for federated learning. We've also done metadata creation and a fair data collection platform, which allows each facility, like I said earlier, to collect new data formats, and this data is federated and it's AI ready. Thus, it can be used for doing forecasting, or each facility can easily report on a new incident, on a new pandemic that's happening, or on any data that they feel like they need to share with the network and globally through the external dashboard. We also ensure accessibility under certain conditions. They need to be allowed, it's under a restricted setting where those that are allowed would be only doing the query or using the API endpoints. Other systems can also take data from the VODAN platform. And we also try to do standardization and verification of existing data, and we are trying the prospect of integrating FHIR resources in defining some of the resources that we use for enhancing interoperability, and also we're making the VODAN platform to be a platform so that other services can be run, other learnings can be done, or other, it's because it's a platform, it can be extended by adding new services or by adding new products. For instance, the verification of bulk or existing data, so that verification can happen quickly, can be an example to this end. And also for our work to be sustainable, capacity building is, we believe, is key. And in our data stewardship program, we have trained lots of data stewards which are capable of using our platform, capable of creating fair data, and also we have lots of collaboration that are helpful in building our capacity, such as the GAIC, the DISH, the African University Network, Fair Connect, and other partners which we are grateful for. They support us in undertaking this. So this we would be Tasfit would be telling us about how the prospect of the standards that we're following and the potential to use fire resources, and Getu will dwell more also on the capacity building and data stewardship program that we're trying to build. I hope I've tried to explain what the VODAN ecosystem or the VODAN platform looks like, and thank you very much for watching.